end of Breast Cancer Awareness Month. The disease affects women all across the globe, but the message of awareness isn't reaching all of those places equally. The Susan G. Komen Fund says one group that needs to hear that message is the Maasai tribe of Kenya. The fund is teaming up with American actor Edward Norton to bring that message to Maasai women. The star of the new film Birdman has been a big supporter of the tribe for the past 15 years or so. Edward Norton joins us now live from New York along with Judy Salerno. She is the president and CEO of the Susan G. Komen Foundation. Now, Ed, firstly, how did you get involved with helping this particular community?
I have some family that live in Kenya, and after traveling there for many years, I encountered some people in this one particular community who were doing just absolutely outstanding work to try to come up with innovative ways to integrate conservation with human health, with education, and I just got incrementally involved over the years and became very passionate about it.
Now, Ed, you ran the New York Marathon a few years ago and incredibly raised $1 million. How has that money been used?
Well, the Maasai Wilderness Conservation Trust, which is the organization we built, went from being a totally bootstrapped, small community-based organization to now, in 15 years, being an organization that's been awarded prizes from the UN Development Program and the UN Environment Program. And the funds that support the organization get used in programs for conservation, education, and health within the Maasai communities of southern Kenya.
Now, Judy, your organisation, Komen, has been present in Kenya for 13 years. What has it achieved so far, and what is it hoping to achieve in the next 12 months, particularly when it comes to breast cancer research? Well, breast cancer screening.
Yes. Well, breast cancer is rising at an alarming rate, along with other cancers in Africa. And we were there 13 years ago, starting out with trying to reduce the stigma around breast cancer, improving public health. And now we're supporting programs like the Edwards program, where we are looking to build programs that can be sustainable, that people can carry through after our funding goes away, and really embedded in the community.
And I think what has to be understood is, like, organizations like Komen are so key, because at the same time that you need on-the-ground, community-based implementation of these programs, the macro resources and the technical training and the expertise that a global organization like Komen delivers are really, really critical to help develop the skill sets on the ground in a community like this. And we, on the other hand, are working on how to use innovative mechanisms of economic development, like carbon credit brokerage, solar conservancies, all kinds of things, to ultimately figure out how do you fund these types of programs in perpetuity without needing the philanthropic support. So it's a really great partnership between a global leader in health like Komen and local people who are very determined to change their own baseline condition.
And Judy, how crucial is breast cancer screening in Kenya, in this particular community?
Well, we know that women come to a diagnosis very, very late, at late stages, when it's more difficult to treat. So we know by early screening, awareness, detection, and getting people into treatment early, we can save lives, and that's our aim.
And in terms of that aim, how will the two of you work together at that grassroots level, which you talked about, Ed?
Well, I'll give you an example. For many years, the Maasai Wilderness Conservation Trust, as a community-based partner within these communities, had raised money to fund a rudimentary health services program, and it was mostly a clinical program, a doctor, a few nurses, a few local health dispensaries, but it was absolutely outside of the resources that were available to us to hire a health program coordinator. And what the Komen Foundation came in and did is actually underwrote the salary for a health program administrator, which just massively leveraged our little organization's ability to connect with National Health Services, to figure out how to procure drugs, to identify the types of equipment we needed. So we got out of a fairly simple type of support, which was simply supporting our staffing capacity. They leveraged a huge amount of change in our program.
And those are the kind of partnerships that we aim for, where we can really make a difference and people in the community can own a program and help it grow to the next level.
Ed Norton and Judy Salerno, thanks very much for your time and keep up the good work.
Great,
Thank
thank
you.
you.